Hello, my name is Dhanraj Parekh, and this is my wife, Sheetal Parekh. We're from UK. My wife actually has been suffering from shortness of breath since 2021. Basically, after pregnancy, she started feeling shortness of breath. She couldn't walk for more than 5 minutes. And then we did the test and everything in the UK. They did some initial procedures in the UK, and she felt some temporary relief. This was in June of 2022. And then in December 2022, we came to India for a holiday, but then she felt sick during the flight, so we had to stay back in India afterwards. So our first meeting with Dr. Arvind was in May of last year, in 2023. Because my wife's case was a bit complex, it took some time for Dr. Arvind and team to sort of come up with a solution. We waited for a year. She was feeling fine for 1 year, but then her symptoms basically started getting worse.
Mrs. Sheetalaben actually had been having problem for many years. I think first time it started way back in 2021 when she had some breathlessness issues during pregnancy, and thereafter it was detected that she has a bulla on the left side, for which she went to Ahmedabad and various places, and there were different opinions as to what should be done, etc., etc. But after a lot of travel and opinion from many senior consultants, she finally came to us, and we realized that she actually has a large emphysematous bulla in the left lung. Bulla means it's a lung which has got destroyed and has become like a balloon, which has air, but there is no air exchange, oxygen exchange, which is taking place. So it was filling the entire left chest cavity. There was no normal lung seen on the left side, and it was almost pressing her right lung, also pressing the heart also. And because of that, the only way to handle this was surgery. So she was offered surgery, and in which we actually removed the entire bulla, which actually was whole of left lung. There was no normal part in the left lung. So bullectomy actually was removal of the complete left lung. But the good it did was that once this big air containing space or balloon was removed, then her right lung had more space. It spread to the left side, which actually was getting compressed otherwise. So after surgery, her mediastinum and the right lung all shifted to the other side, and her breathlessness issue improved. And I think in times to come, she just has to take precaution that she should avoid exposure to smoke and dust, because these two are the enemies of lung. Right lung being normal will allow her to do normal life. There will be no interference in the day-to-day life as long as the right lung remains all right. So I wish her all the best, and I'm sure she'll take good care of her only lung now and will do very well for decades to come. All the best to her.
Dr. Arvind and the team have been extremely professional. They explained the risks, and as well as not just the benefits, but the risks as well with the surgery. We felt safe and we felt comfortable with his decision to remove her left lung completely. The whole team at the ward was extremely professional. So Dr. Arvind Kumar has been a godsend for us, for a lot of different reasons. Obviously, it was his team, his push to make my wife lead a normal life that basically enabled us to have the surgery in the first place. My wife has been dealing with this issue for nearly 4.5 years, since 2021. Before, she couldn't walk for more than 5 minutes. She was suffering from shortness of breath. She couldn't play with our daughter as well. And now she can cycle for 30 minutes. She can walk more than 5 levels of a building. And Dr. Arvind Kumar said she can run. Before, she couldn't fly on the plane, but Dr. Arvind just today said she's a normal person. She can fly. She can climb a mountain if she wants to. So we are extremely happy about the outcome, and again, extremely happy with Dr. Arvind and the whole team who have helped us to reach this point where she can lead a normal life. So thank you so much, Dr. Arvind and team, for allowing us that.